Hi, I'm Debopam Samanta, MD, pediatric neurologist and epileptologist, associate professor of pediatrics in the College of Medicine. Let me start with a very unfortunate event that happened a few years ago when one of my patients' mother called me that she passed away in the middle of the night after a prolonged seizure. Family later realized that she was not taking her seizure medicines, and she was also not following some of the practices that we call self-management practices, such as recording and tracking seizure, communicating with healthcare professionals, taking medicine regularly, maintaining stress under control, having a good coping mechanism, maintaining an appropriate social network, having a good sleep habit. I routinely see implementation failure in terms of self-management intervention in routine clinical care. There had been some progress in self-management intervention in adults with epilepsy, but very limited work has been done for children. Most importantly, and no previous studies looked into African American children with epilepsy and their self-management practices. However, African Americans have high risk of poor epilepsy outcome. They have high risk of medication non-compliance, high risk of not getting access to specialist care with neurologist or epileptologist, high risk of acute seizure emergencies requiring coming to the ER or hospital, even high risk of sudden death. So our research aim is to look into this vulnerable population, African American children with epilepsy and their caregivers, understanding and practices of self-management skills by doing in-depth qualitative interviews. We also interview neurology providers. Those are taking care of these patients to get their views and opinions. We form a community advisory board and bring all the emergent teams to the board. And also we discuss our existing self-management educational material. Based on all this, we form a comprehensive educational curriculum comprising of different modules, and then we deliver these educational materials directly to the African American children and their families' home using a telehealth platform. So the real success of the project would be if the patients and families, they find these telehealth interventions acceptable, they are satisfied with the program, and they are adherent with the program. And we also do before and after assessment of their self-management knowledge and practices after this intervention. We tackle recruitment problems by involving community advisory board and the neurology providers very early in the research project. Now, if the research project is successful, we will plan to have this telehealth intervention to a larger cohort, and we want to bring these interventions to routine clinical practice. That would definitely solve a critical need and gap in our care, in our clinical care, that many patients, they don't receive self-management education and counseling. And this would be particularly useful, this telehealth intervention, because that would solve the access problem in a state like Arkansas, where many families need to travel long distance to come to the clinic. This would be particularly applicable for underserved population. And we also want to measure in future studies the objective changes with self-management practices pertaining to their medication compliance, ER visit, or hospitalization due to seizure emergencies, if the self-management practices can decrease those. Thank you for your attention.